Welcome back to The Fix, where we're tackling your biggest problem areas. It's the first sign of facial aging, drooping along the jawline or jowls. But forget the facelift, because a new miracle shot could give you the same results without surgery in as little as 5 minutes. It's one of the most embarrassing signs of aging, and just about impossible to hide. Sagging jowls. The cause? As you age, you experience bone loss, and your skin loses its elasticity. There used to be only one cure for that unsightly skin below your neck and jawline: surgery. But now there's a game-changing non-surgical fix. It's an injectable filler that works by stimulating your body's own natural collagen production and adds volume to your skin. The result? A smoother, more youthful jawline that can last up to 18 months. In as little as 5 minutes, you can take years off your appearance. New York plastic surgeon Dr. Sharon Giese is here. Dr. Giese, welcome to the show. Why are jowls such an important issue for women? Why is it a sign of aging?
I think it's the biggest first sign of aging. You have women who are in their 20s or 30s, they just don't have a jowl. So even if I see a gorgeous woman who's 30, 40, wrinkle-free, when I see that jowl, I know what her age is. So it is a true giveaway.
Let me explain to everybody why we get jowls as we age. So if you look at this quick animation, you'll see on the side of the face, if we really get into why you get jowls, you get a little bulging of fat as we go from being a young woman to a more mature woman. And that aging process is in part related to gravity pulling down on the skin, part the accumulation of some fat there. And if you look inside, we see there's actually retraction of skin pulling away from the underlying bone. So it's the sagging together with the fat, and sometimes even resorption of bone that gives rise to this. So joining us now is Naomi. Welcome to the show, Naomi. Naomi is 52 years old, and she wants to get rid of her jowls, I am told. Why do you hate your jowls so much?
They made me feel very tired, angry. People say, why are you scowling? And I'm happy, but yeah. I look sad all the time.
Dr. Giese, how do you know if Naomi's a good candidate?
I think she's a good candidate because she has something that's called a pre-jowl notch. But I can just, here, you can see there's just a little thumbprint area right before her jowl. We can see her jowl right here. And just here, I can almost put my thumb right into that area. And this is the area that I'm going to fill, and we're going to restore her youthful jawline.
Are you interested in this?
Oh, yes.
All right, come have a seat here. Dr. Giese is about to do this procedure for us right now. And if you don't mind walking us through some of the basic steps, so everyone at home can understand what we're about to do.
Okay. So first, backstage, I'd put a little bit of numbing medicine on her so she's not going to feel this needle injection. So let me just clean the area. And once again, explain to you, this is the area of the pre-jowl notch. I mark it. This really helps me out, too. And again, this is her jowl. I can just kind of mark that. And then sometimes the area right behind the jowl, the mandible absorbs some bone and also loses the jawline. So, oh, thank you.
I'll be the assistant today.
Oh, fabulous. I love it. Okay, here we go. So,
I'll hold your hand here.
This is a wonderful filler called Radiesse. Now, I use many, but this is my favorite for this area. You can touch it. It's very soft. It's a natural substance. It looks and feels natural in the skin, but I prefer it for this area because you could get a little pinch. In, right? 1, 2, 3. Because
I didn't feel it.
You didn't feel it?
Not at all.
I'm going right down to the bone because it adds beautiful structure. So I'm just putting it in right now. And you can see a little clumping already.
Can you all see that? It's starting to grow. Are you okay?
I'm great.
It doesn't hurt?
It doesn't hurt at all. If it did, it would be worth it.
So
but it doesn't.
Now this is called Radiesse. How does this differ from Restylane, from Juvederm, and other sources of filler as well?
This, I would say that Radiesse has more structure to it. And as you could see, when I just put a little bit on my glove, the consistency is a little bit closer to toothpaste. And Radiesse, or Restylane, or Juvederm is a little closer to water.
And what does it cost?
And this costs about $500 to $800 for a treatment, depending how much I do on her. So now we have one that's here. a little bit of molding, and then I'd like to do her other side, and I'll get a little bit over there.
Get the alcohol for you.
Please. Oh, this is fabulous. Thank you. Actually, I'm going to mark her again, because I want to mark again the pre-jowl notch. This is the real giveaway, and when we fill that in, it's just this little tiny triangle here. I'll get some back there.
Is this a procedure you do commonly?
I do it commonly just because if someone wants to avoid surgery, this is how you can do it for a quick fix, because again, you can see we're going to have an immediate result.
About to stick.
Ready? 1, 2, 3.
I don't think she needs me here at all.
She's taking advantage.
I know. I'm just sitting here.
Assisting. Oh, and I have a handsome doctor for an assistant. It's really a special day for everybody.
It really doesn't hurt. I'm shocked.
And so, duration, how long does it last before we have to read this?
For me, I see this lasting about 1.5 years.
And when it goes away, a year and a half later, similar type procedure to rebuild it?
It's gradual. It's gradual. You could do a similar procedure, or I actually take away some of the jowl. Let me have you turn your head a little bit. I'm going to come a little behind your...
Actually, before you do that, before you do that, turn this way for 1 second. I just want to show everyone a before and after. So, if you don't mind, I want you to get a picture up here of what Naomi looked like before.
Right.
And then let's compare that. This is just before we started the procedure. You just see those little notches? I mean, that is a big difference. That is a big difference. Dr. Giese, congratulations. Thank you very much. Naomi, it was wonderful. And keep smiling. You have a beautiful smile with or without the jowls.